We have some big news coming in. One more positive COVID-19 case in Karnataka. A 34-year-old man tests positive in Udupi for COVID-19. The infected man has a travel history to Dubai. The infected patient returned from Dubai on March 18th. He was admitted to a hospital in Udupi on the 23rd of March. Now this is the big news that we are currently tracking. A 34-year-old man tests positive for COVID-19 in Karnataka from Udupi. For more on this, I am being joined in by my colleague Neha Ban from the newsroom. So Neha, another positive case in Karnataka. So what more details do we have, and total how many positive cases have been reported from the state?
There seems to be some discrepancies as per several other reports. It's being said that the number of positive COVID-19 cases in Karnataka stand at 43, and with this the number of cases actually rises to 44. So we are anticipating health bulletin shortly, and we hope that the confusion will be cleared over this. But coming back to this particular case here, Deepak, a 34-year-old man who had tested positive for coronavirus. He has a travel history to Dubai. Now remember, he had traveled to Dubai on the 18th of March and tested positive for the novel coronavirus only some days ago. So that means that coronavirus can actually take some time before the person starts realizing that he has developed symptoms for the deadly virus, which is why it becomes all the more important for the people to stay indoors, not venture out, not roam out. When when the Prime Minister also yesterday addressed the nation, he requested all the people to stay indoors, also trying to explain the importance of social distancing. The state government has been continuously requesting the people to stay indoors, do not come out, because they are not only posing a threat to themselves but a significant threat to others as well. So as the health officials, as the senior experts also continuously have been saying that it is absolutely very important to at least maintain 6 feet of distance with the people, and you never know that the person whom you're interacting with or you're standing with might have already developed symptoms of COVID-19. So having said that, now it also becomes a Herculean task for the health department officials to figure out how many people had actually come in contact with this person who has tested positive for novel coronavirus. Those people also need to be quarantined or kept under isolation. Now coming to the scenario at the state, of course, given the fact that the state government has given a directive that a complete lockdown will be implemented, and of course just yesterday Prime Minister also made it clear that the entire country is under severe lockdown starting 12 midnight. But even though the people do not seem to be taking it very, very seriously, the meaning of lockdown itself means that the complete, the activities that we all are used to do, on a daily basis need to stop. That means that there is a state of emergency. Coronavirus, remember, Deepak, has claimed the lives of thousands of people across the globe. Of course, the epicenter is China. China tried its best to contain the spread of novel coronavirus. Prime Minister Narendra Modi yesterday rightly said that if you do not practice social distancing for these 21 days, then India might step back for 21 years. And nobody really wants that, given the fact that we've already lost over 10 lives, and there are several other people who have tested positive. In India alone, over 550 people have tested positive for novel coronavirus. The people do not seem to be still taking it seriously. They think that these are summer holidays. No, absolutely not. They're not summer holidays. This is an actual situation which the entire country, an unprecedented situation that the entire world is currently battling. There are many people who have lost their lives. The health department officials are also continuously requesting, as I earlier as well mentioned, to practice social distancing, stay inside your houses. If it go out, only if at all, it's extremely important. Even if you go out, make sure that you're taking enough preventive measures, make sure you're wearing masks, and also make sure that you're maintaining 6 feet distance with the people, as coronavirus primarily spreads from person to person. It's extremely important to sort of make sure that you're maintaining the basic hygiene, washing your hands for 20 seconds frequently, also staying indoors. You're avoiding crowds, because as just today we were just showing the viewers the reports from various districts. People continue to throng markets to buy essentials. We understand, but then the Prime Minister as well as the Chief Minister has continuously requested the people that there is no need to panic, as the essential services are not going to shut. We also have now seen another positive case in Karnataka. 34 34-year-old man. You know, the people are of the view that coronavirus only affects the older generation, people above 60 to 65. Yes, they are more vulnerable to coronavirus, but that does not mean that the younger generation cannot get it. Anyone and everyone can get coronavirus. They can get infected by the virus. It's always advisable to take precautionary measure. Remember, prevention is always better than cure. Over to you, Deepak.
Right, Neha, thank you for joining us with all those details.